Hi, Dr. Charles Sevchik here with the Life Enhancement Clinic, and I want to talk to you today about phase 5 of homotoxicology, the degeneration phase. This is the point that occurs after all these invading toxins have overwhelmed the inside of your cell and now begin to actually shut down your cell and kill your cell or degenerate your cell. We associate this with common neurodegenerative conditions such as Parkinson's and Alzheimer's and dementias, degeneration of your joints as in rheumatoid or osteoarthritis, cancer, diabetes, metabolic syndrome, all these things, the chronic degenerative diseases that we associate with the standard American diet, the standard American way of living, what's affecting the majority of people around us. And so when we look at this phase 5, this is where you will find some abnormalities on your regular blood test. This is where you're going to go into the doctor and more than likely have something that's going to be red flag that will lead to you to more testing, and it might find an underlying cause and you might not. Now the frustrating thing to me is this: so many times people are just kind of shuttled along and miss all of the warning signs. They look at all of the blood markers and the elevated triglycerides and the elevated body fat and the abnormal BIA and all of these things that should be alerting the practitioner that there's something wrong with your health. But instead, they go to the doctor and they see that their fasting blood sugars are 119. Well, since its diagnosis of 126 over a period of 2 or 3 tests is needed to diagnose diabetes, you can't be diagnosed with diabetes and you're not going to be treated with any medications. And the doctor might say, well, at 119 you don't have diabetes yet, so go ahead and come back in 6 months to a year, and then when your blood sugars get worse, then we'll start treating you with medications. And oh, by the way, eat right and exercise, and then you're out the door. That's a huge disservice to you as the patient, because in the degenerative change, you can reverse even in this stage. Now, what's exciting is even earlier this month, the condition of diabetes, which for years you've been told that once you get diabetes, the best you can hope to expect is to manage your blood sugars, and then it's going to lead down that slippery slope and you're going to be taking insulin and needing drugs for the rest of your life. Research came out this month, and it was published this month, and showed you can actually reverse diabetes in as little as 1 week. And actually in the study, they did a 1 week to an 8-week study and totally reversed the changes of diabetes. Now, what's exciting about that is that's how we have built our Wellness Week. Our Wellness Week is a program that you can find more about on our website and watch some testimonials. Patients coming in with acute pancreatitis, type 2 diabetes, chronic fatigue, and the list goes on, finding relief from their symptoms in, yes, just 1 week. And now we have some scientific literature substantiating that. Now, so that's pretty exciting. Now, when you look at this, though, metabolic syndrome, prediabetes, far predict the overt disease of diabetes, meaning this: you can look at the warning signs, take care of the warning signs early in phase 1 or phase 2 or phase 3, so that you're not actually in this phase 5. However, if you're watching this video and you find yourself in phase 5, in degeneration, with an overt disease, a disease of chronic illness and advanced metabolic aging, there's still hope for you. And so I want to encourage you to get on the right track, find a practitioner that's able to work with you and actually rebuild your health and start to revitalize the health of your cells, reestablish the integrity of the cell membrane, and bring you back into a normal balance of health and wellness. I hope this video is helpful. Hope you find it has some value to you. Be hopeful, don't give up hope, and hang in there. Thanks for watching.